Hey guys, my name is Jeremy, and today we're going to show you what's in a central line kit. It's important to kind of know what you're getting into before stepping in the room to do a procedure, just to know all the different options you have to correctly and safely perform the procedure. So we're going to walk through the contents of a simple central line package and kind of go through the different steps. And stay tuned for the next video because we're going to go through a central line tutorial. All right, today we're going to explore what's inside this triple lumen central line kit here. On the outside, it lists all the contents of what's in this package, so you can kind of go through that. Each package seems to be a little bit different depending on the brand. Up top here, we got a 7 French, triple lumen, and 20 centimeter length. That length is going to be along for a lot of the target sites. So if you're going to insert this one on like a right subclavian, that's a pretty short path to the heart, you're probably going to need to have a little bit of slack. You can open up the contents here, pull them out. You can put stop, do not enter outside the door for quiet time during the procedure. And you've got more monitoring forms here. You also have some stickers you can put on the chart and peel those away just for your reference. All right, let's open up and see what's inside. All right, so in this kit, start undoing the packaging here. And we've got 2 chlorhexidine swabs that we can use to clean the neck or our target site. We've got a mask, and this protective eye cover is removable if you already have eyewear for your procedure. And then you've got a cap. It does not come with sterile gloves. You're gonna have to pick out your own size for that. Opening up further, the next layer. And on this next layer here, we have a towel. So if you just washed your hands prior to this procedure, you could dry it off on this towel. We'll put that over here. Let's just flip this around because we've got our sterile gown here. It's an extra large, so it accommodates most people trying this procedure. You would just enter through on this side and then get your assistant to help tie the back. We're not going to completely undo a drape. You can look up a sterile donning video for that. And then finally we get to our kit here. We're going to be all sterile at this point as we open this in the real world. Open this up. All right, and now we have this maximum coverage drape here. Easiest way to handle this one is just to kind of fold it like a taco, like so. You would remove this and place it over your site. And notice the arrows here. You would start to unravel it this way. The patient's head would be this way with this picture. And then you would go up and then start folding out and cover up your potential central line site as well as the rest of the patient. The nice thing about this kit is it's organized from left to right and top and bottom. The one thing this kit does not have any sterile saline for your flushes for the lines. So you're gonna need an assistant to drop 3 of those in there because we have 3 lumens to this central line here. On the left, we've got our probe cover. So you're gonna wanna take care of that first. You would do a liberal amount of jelly on top of the bare ultrasound probe, and then you would unravel this and have your assistant feed the ultrasound probe, and then you would cover it up, put the rubber bands on there to secure it, and then apply a liberal amount of jelly on top of that. One common mistake is not applying enough jelly. Then you get into the procedure and then your picture quality is poor. So you want to avoid that mistake. All right. This is our Tegaderm dressing for when the line is done. We can put that aside. And notice our kit is divided up into 3 sections. This is our pre-insertion, our insertion, and then our post-insertion section here. Okay, here's our kit organized very nicely into like a pre-procedure, peri-procedure, and post-procedural area. On the left side, we've got all of our needle configurations here. We've got a blunt needle that we're going to use to draw up our lidocaine, which is located over here. So we would take that out if we need to numb the area. We also have different syringe options. So here's a 3cc syringe, here's a 5. So we could swap those out depending on our lidocaine needs for the procedure. If you need to discard any sharps, you could do that over here in the post-procedural area. We've got a 25 gauge protected needle that you can use. That's a little bit shorter. And then we have a longer needle as well. So lots of different options. Over here we have a Raulerson syringe. This is good for vascular access. Notice it's got the hole on top, and this hole you can feed your guide wire right through. So you can feed your guide wire right through without having to deal with disconnecting your needle if you need to. So that's a nice added feature. What's also included in this kit is a catheter over needle option. If you like to go about things this way, you could, when you go do your cannulation, when you find your site, you just slide this catheter right over, and then your hand's free to then insert your guide wire. The added benefit of this setup is you could slide your catheter in, and then you have this tubing here which can help detect arterial versus venous puncture. So you've got this in the vessel, and you could just attach this and let it fill up with blood and hold it upright. If the blood continues to travel up the tube, it's likely arterial versus venous if you're not able to tell. I've never had to use this, but it's nice to know that it's there if you get a confusing case. So let's reattach all this. All right, and then here we've got our guide wire. Notice that it's capped, and that as soon as you uncap it, it's got a hook to it, and that's a safety feature. If you can see that up close, looks like a cane. That way it's not sharp moving around a vessel when you move it forward. So if it moves against a vessel wall, it's gonna hit that rounded portion versus the sharp edge. And you can pull it with your bare hand, and you can push out with your bare hand and extend it if you need to. But it's good to get this ready. You just use your thumb to advance it. And as I was showing you, you can use this to go right through this little hole here. And then it comes out that end if you need to go about things that way. So we've got our guide wire, and we've got a blade to make a puncture into the skin to get ready for our dilator. And this would just go over the guide wire and use a twisting push motion to dilate that area. And then finally, we've got our triple lumen catheter here. Notice that all three of these are capped. You're gonna wanna remove these. And the other part I didn't say earlier is you're gonna need the tops to all of these, which are not included in this kit. For the procedure, you're gonna screw on the tops for these two and keep this one open because that's where the guide wire comes through. And I'll just demonstrate that really quick. So for feeding the guide wire through, and then voila, it comes out the brown port. So always comes out of the brown port. You're gonna wanna pre-flush your line. So when I talked about this kit doesn't come with your saline flushes, you're gonna wanna flush those, and then you're gonna flush them after you insert this into your vein. So you would just slide this through. There's different depth markings here depending on what you're trying to do. That's 15 centimeters. So depending if you're going right subclavian or if you're going IJ, you may need to go a little bit further up. But then you can always lock these in after you flush them and get flashback so that no air is getting in your your catheter kit. Next up, and also within this, you have a second site fastener and clip. So if you need to suture down this site to the skin and then you want a extra fasten point, you would just put that over the catheter and then pop this on top and then just suture in that for another anchor point for this line. And then of course you have your needle driver, and then here's your actual suture needle, and then you can just use your scalpel to cut as you're suturing. And then everything on the right is your post-procedure care for some serum container and for discarding the sharps. And that's all that's included. I think the one thing I left out was just a smaller transducer needle. This one is a 22 gauge needle. That's what's inside a central line kit. It's important to familiarize yourself and know what you're getting into in the procedure so you can minimize distraction and have a successful cannulation of the vein that you're trying to get into. Thank you guys for watching, and stay tuned for more videos.